My name is Colette Abbott, and I'm a hospitalist at Harborview and the director of the Global Health Pathway. I was a resident in your shoes many years ago, and after residency went on to do the Global Health Chief Residency in Naivasha, Kenya. So I'm going to talk to you about the pathway today, but if you're interested in any of those other things and want to reach out, feel free to. This is the backbone of the Global Health Pathway curriculum, and I'm just going to go through it briefly. We have coursework, research or scholarship, mentorship and community building, and then a bonus optional clinical elective that you can do within the pathway. The pathway started in 2009, so it's been ongoing for a long time. It was created by a former resident and chief resident. And one foundational portion of the Global Health Pathway is coursework. So our residents get one block, block 4 of our 2-year, blocked off to do an immersion block where we talk about foundational concepts in global health. And it's really a course to teach residents the skills necessary to become future leaders in global health. So they enroll in Global Health 575, Leadership for the Clinician. It is required for all internal medicine pathway residents, but we also have residents join us from other UW specialties who are in maybe a emergency medicine global health pathway or others. And then we have UW Global Rural Health Fellows join, and usually 2 to 3 Malawian residents who join us. I teach it along with Jessica Bender, who you may know from Adult Medicine Clinic, Aftercare Clinic, and she's core faculty. And what we do is we bring in experts to talk about foundational topics in global health, talk about their careers, and to basically offer their services as potential mentors for our residents. So here's an example of some foundational topics we talk about, things like decolonizing global health, ethics in global health work, capacity building, and then there are a lot of other kind of subspecialty topics that we have speakers come and speak about. Another portion of this is that we set aside time to visit some of our partner institutions, but a lot of NGOs around Seattle who are doing global health work, but we have the benefit of being in our backyard. So we go places like the Bill and Melinda Gates Foundation, PATH, Village Reach, and get to speak with some people who work there and learn about what their careers look like as current or former clinicians and working with NGOs. And then on top of that, we have kind of built-in time for mentorship from myself and Jessica, and then speakers who come to the course. The second portion of the Global Health Pathway is research or scholarship. This is something that's required for all pathway residents. It is set up so that you would get 2 or 3 protected research blocks split between our 2 and our 3-year. And this research can be done abroad at a partner site, or it can be done remotely from Seattle in collaboration with your partner site, whichever you and your mentor think is it's best set up for. The 2 or 3 blocks is contingent on whether you do the clinical elective or not, which we'll talk about in a little bit. And then the next component is mentorship and community building. You do a lot of clinical work and a lot of excellent learning in the hospital here in Seattle, but there's not a ton of time to sit down and think about global health work or even meet the players who are involved in that in UW. And so one part of this pathway is trying to expose you to that and give you some protected time and space to do that. Some of that's during the course, but also through things like works in progress with your co-residents, talking about projects, what's working, what's not, and workshopping those to try to figure out how you can make them more effective. We do social gatherings, and that might be centered around a topic or a talk in global health, or it might just be meeting up somewhere outside of the hospital at a park to gather. And then it lends an opportunity to be with like-minded colleagues. So, you have a lot of amazing residents surrounding you. Some of them will have no interest in global health, and our hope here is that we get to kind of bring together a subset of people who have some common interests and might use those to help shape their career. Lastly, the clinical elective, I have an asterisk here because it is optional. It is not a required part of the global health pathway, though I think is an excellent opportunity and people should do it. So this is the NIVASHA clinical elective. If you're in the pathway, I've included it here because if you do it, it replaces one block of research time. So you get 4 blocks total of protected time, and that's the immersion block, and then 2 research blocks and this clinical elective, or 3 research blocks and not this clinical elective. I'm gonna separate out the clinical elective because I want everyone to sort of pause and listen to this part. If you're not interested in the global health pathway for whatever reason, but you are interested in having a clinical experience working abroad, I want you to pay attention to this because this is an opportunity that's open for both pathway residents and non-pathway residents. So you do not have to be in the global health pathway to do this rotation. It's the rotation in Naivasha, Kenya, and it's under the umbrella of the Clinical Education Partnership Initiative, or CEPI, and that is a collaboration with the University of Nairobi and Naivasha County Referral Hospital and UW. And it was established in 2012 under the premise of this being similar to our WWAMI model, where we feel like it's important for residents to get exposure to both urban and rural settings. And so this was set up to be a rural site for University of Nairobi residents. And then a rural and urban and rural and global health site for our UW residents. Over the last 12 years, we've had over 250 participants and over 150 UW residents who have gone and taught and learned in this hospital. It's a 4-week elective, and it has to be 4 weeks. You can't take vacation during that 4 weeks, and you can do it in your R2 or R3 year. And the rotation is really built upon an experience centered on clinical work, and then alongside that clinical work and working alongside our Kenyan colleagues to take care of patients, a ton of didactic teaching, but I think more importantly, bedside teaching, guiding the care of our clinical work. And then a lot of opportunity for POCUS that's grown and grown, and there's actually a formal curriculum that's being introduced this year. So if you're interested in POCUS, great opportunities to teach and to learn there. Our residents here are supervised by the CEPI chief resident, or the global health chief resident. And this year it's Ruth Dea. And she and our chief residents in the future will be there year round and there to support our residents and this collaboration. Again, it's available for pathway residents and non-pathway residents. And like I said earlier, if you are in the pathway and you do this elective, it means you would have 2 months of research, not 3 months of research that would be protected. Going back to the pathway, the applications are due the same time as all the other pathways in January. I want to highlight here that we have requirements for the application that take time and planning. So you have to identify a mentor and a project for the application to the pathway. You can't just say, I'm interested in global health and I want to do a project. I'll figure it out later. And you need a letter of support from your faculty member. So what that means is you have to start early. If you're interested, I would start now. And probably the next step, if you're interested, is to email me to set up a meeting, because I can help you find mentors. I can help you be set up for success in the application if I know early, but I can't if it's, mid-December. So please reach out if you're interested. I'd love to hear from you and meet with you. And then just to close out, I wanted to highlight some of our current residents. If you run into Will or Abdi or Dan or Sharmila, they're all currently in the pathway and I think are doing amazing work and probably can tell you a lot more about it. So thank you for your time. I hope you have a great day learning here. And here's my contact information. I'd love to hear from any of you about the Global Health Pathway or anything else that I've spoken about that you think would be worth meeting about. Great. Bye.